It is the first day of school for students all across the Triad. Most are learning from home, but some are back into the classroom. So no matter what your child is doing, there's always a chance they could be exposed to coronavirus, which is why we have an expert in today. In today's To Your Wellbeing, what you need to know about kids and COVID-19. Dr. Suresh Nagapan, the medical director for the children's unit at Moses Cone Hospital, is with us. And let's just start with this. Some children are more susceptible or more at risk for COVID-19 than others, yes?
That's true, actually. So kids who've got chronic illnesses, we found that they are a little bit more likely than others to get COVID-19. Over the course of these past few months, what we've discovered are kids with asthma and kids with diabetes actually haven't been that much more likely to get COVID. That was the worry in the beginning. Well-controlled diabetes and well-controlled asthma, those kids have actually been doing pretty well. On the other hand, kids with congenital heart disease, chronic lung disease, sickle cell, and those kids with obesity, those kids have had higher rates of getting COVID and have been a little sicker when they do get COVID. So the parents of those kids, they don't have to panic, but they do want to take extra precautions. All the things that you've been hearing about this whole time about hand washing and social distancing and masking, that especially applies if you've got a child with a chronic illness.
Yeah, and that's kind of hard, right, to teach your young kid who may have one of those underlying conditions how to social distance and things as it goes on.
It's very hard. Easier said than done for sure, and the younger they are, I think the harder that it is. But a lot of it is kind of leading by example and trying to keep your kids out of situations where they're going to be in crowds, where it's really tough for them to social distance.
And of course, the schools, if they are going back to school, they are trying to keep them that 6 feet apart, like at the desks and things. So how safe then is it for children to get together with a few of their friends to play or study? And maybe, you answer the question for those with the underlying conditions and those that do not have the underlying conditions.
Yep. So, I mean, the truth is that the safest thing you can do is really keep your kids out of situations where they're in close contact with other kids. But, we're all human. I have kids too, and it's tough. It's one thing if it's a week or a month, but now this is lasting 6 months and maybe a year or more. So you've got to balance things. You've got to balance your child's social health and emotional health with their physical health and the risk of spreading it to others. And so I think you've got to look at your own child and your own risk factors in your family. If your child's at high risk or there's someone in the family that's high risk, then I think being as distant as possible is the best thing to do. On the other hand, if you don't have those things, I think you can create a space that your child can interact with other kids, but in a safe way. And so always remember the things that really help prevent the spread of COVID is, one, outside is better than inside. Number two is wearing a mask. That means even when you're playing outside, having your kids wear a mask. And then keeping distant, keeping that 6 foot of distance. So it's possible to play, it's possible to get together. If you can respect those 3 big factors, that's going to make a big difference in preventing spread. The other thing that helps is avoid having kids share food, and then also limiting the number of kids that your kids might interact with. So 20 kids is a lot. If it's 1 or 2 kids, that's different, and that's probably a better situation. So again, all these things are easier said than done, but I think we all realize that it's impossible to isolate children forever, indefinitely, and so we'd rather have people interact with other kids, but do it in the right way, in a way that's going to prevent the spread.
Right, you got to keep everybody in your own bubble and be careful who you're letting in your bubble.
That's right.
So we get this question a lot. Is it riskier for the child's health to go to school and possibly get coronavirus, or is it riskier for the child to bring home the coronavirus to someone that lives with them?
That's going to be specific to each family. So if your child themselves has some of these risk factors that we talked about, then it might be a bigger risk for them. On the other hand, if you've got older relatives or relatives with chronic disease who are also older in the household living with a child, then it's probably a bigger risk, the child bringing COVID back to the household and spraying it within the household.
What about, sometimes it's hard for adults to wear masks, but then you got a kid who says, I'm just not going to wear this mask. So as a parent yourself, how do you help that out? How do you get them to wear that mask?
I think that's a really tough thing. We are asking a lot of our kids during this time. This is, it's unprecedented in so many ways. And if we think of like all us grown-ups, none of us lived through anything like this when we were kids. So I think number one, when your kids won't wear the mask, is have some understanding, have some empathy for them, that this is a stressful time for them, it's scary for them, they don't totally understand what's going on. So start with that empathy. But then there are a few things you can do to help out. So if your kids are older, remember a lot of what they're feeling is feeling helpless in all this. And so giving them a role, giving them something that they're doing helps a lot. And so, I'm just honest with older kids, just saying, like, the reason to wear masks is to protect others. And that's your role in all this. Everyone has a role. There's first responders out there, there's essential workers, but your role is wear a mask and protect others. Now, when you got younger kids, there's some different things you can do. So some of the issue for younger kids is it's just kind of scary to wear a mask, and it's unnatural and doesn't feel right. So you can slowly introduce them, and there's a few things you can do to help make it a little bit more normal for them. One is have you and your child wear a mask and just look in the mirror and talk about what it feels like and what it looks like. You can also have them put masks on their stuffed animals, talk to their stuffed animals, play with those stuffed animals. You can try to make the mask more personalized or decorative. That always helps, makes it feel less cold and clinical and a little bit more, a little bit of a warmer feeling for them. You can look through other pictures of kids, online wearing masks, just to normalize it a little bit, drawing characters with masks. And then, some of it is just keeping that mask on. I mean, you can imagine with kids of almost any age, it's really hard to have them keep it up. And it's not the most comfortable thing all the time to have that mask on. So some of it is just building tolerance. So if your kids are at home right now and you're expecting that, virtual school may end in a few months or whenever that we all go back to in-person school, you can spend that time kind of slowly building up their mask tolerance, doing a little bit more each day to make it a little bit more comfortable for when they might be out and about and needing to wear the mask for a longer period of time.
Mm-hmm. What are the symptoms that parents should look for in kids? Are they the same as adults, or are there certain symptoms that are more pronounced in kids?
There's a lot of the same symptoms in adults as in adults. Kids can get short of breath, kids can have breathing problems. There's a few things that are a little bit different. So one is kids tend to have a little bit more of the stomach side of issues, stomach pain, sometimes diarrhea, sometimes vomiting. That's less common in adults and a little bit more common in kids with this. There's also a collection of symptoms that we always want parents to watch for, and that is if you see your child who's got red bloodshot eyes, lymph nodes that you can feel in the neck, swelling in the hands and feet, a rash, any of those symptoms, those can be associated with COVID-19. There's a disease called MISC, multi-inflammatory systems in children. And that disease is associated with COVID. Is quite rare, but we do want people to be on the lookout for it. So if you see any of those symptoms, that's a good reason to call your doctor.
Mm-hmm. Some people were asking, is it safe to bring my kid to the doctor's office for their vaccines?
To that, I would say absolutely. I think it's really important and vital that parents still bring their kids to the doctors for vaccines. As scary as COVID is, what you don't want is to get a whole other disease because you haven't been vaccinating. And the worry is if we get enough people who are nervous about vaccinating, we'll get a critical mass of people who aren't vaccinated, and that will allow some of these older diseases to spread. So it's really important that you go in. The good thing is, knowing all the pediatricians and family doctors in town, these offices are doing a great job trying to keep your kids safe when they do come in. So they are trying to separate sick kids from well kids. That helps a lot. They're trying to reduce crowding in waiting rooms. A lot of offices are using telehealth whenever they can, and that also decreases crowding. They're doing a good job cleaning the rooms. So all those things are going to make a big difference. And then most doctors' offices are pre-screening, so they'll call families before they come in, and if there's a high risk that that child or family might have COVID, then they'll find an alternative way instead of bringing to the office, and that way they don't infect other kids like yours when they come in to get their shots.
Which parents like to hear that. They don't. They want to make sure that their kids are safe. Yeah. All right, we already have a slew of questions. We hope that you will be texting in your questions as well. The number is 336-379-5775. Does COVID do anything with kids when it comes to their sleep? Can kids under 5 get the virus easier? We're going to answer those questions and more when we come back.